Hello and welcome everyone. This is a quick review on histology, particularly on hematoxylin and eosin staining or H&E stain. We are indebted to the Loyola University Medical Educational Network or Lumen for the excellent histologic slides which we will see shortly. Hematoxylin and eosin or H&E is the most common laboratory stain. Hematoxylin is a bluish purple dye, while eosin is red. Nuclear chromatin has a high nucleic acid content and therefore is attracted to the blue, more basic dye. That is, it is basophilic. Everything else in this picture is relatively neutral in character and takes a wash of eosin. We will now look at how different cells, tissues, and structures in the human body look like when stained with the ubiquitous H&E stain. In this low-power view of the intestinal wall, rows of epithelial nuclei impart a darker, bluer color to linings of surfaces and glands, as seen to the right of center. The outer left-hand layers show the pink of muscle cytoplasm. The middle layer of dense, irregular connective tissue shows how brightly collagen fibers can be stained with eosin. High power view of smooth muscle shows that eosinophilic color is mainly due to the cytoplasm. Nuclei are quite scattered and have only small, granular clumps of blue heterochromatin. The nucleoli, which are around 1 or 2 per nucleus, are stained blue with the hematoxylin. This organ, the thymus, appears very basophilic in H&E stain. And at high power, the reason for the thymus's basophilia is clear. Because the thymus is packed with lymphocytes with darkly stained nuclei. Isolated structures such as this whorl of cells in the center are specifically acidophilic. That is, they are eosinophilic. They have higher affinity to eosin. Different cells take different shapes. These are, for example, epithelial cords of block-like cells. As always, the nucleoli and the nuclear heterochromatin stain darkly with the hematoxylin, while the cytoplasm are eosinophilic, staining highly with eosin. These are blood cells which are suspended in fluid plasma. They characteristically have a round shape. Red blood cells are mostly cytoplasm and they are therefore eosinophilic, while this neutrophil over here exhibits an eosinophilic cytoplasm, but the nuclear chromatin in the nucleus is deeply basophilic. Here are some nerve cells seen in low power. Their nuclei are pale and vesicular because it contains mainly euchromatin. Euchromatin does not stain deeply with hematoxylin, unlike heterochromatin, which stains deeply with hematoxylin, and therefore heterochromatin, unlike euchromatin, is basophilic. However, we still see, of course, the nucleolus, which is dark, and the cytoplasm, which is also filled with clumps of darkly staining basophilic material. And this basophilic material in the cytoplasm is ribonucleic acid. Nerve cells are typically stellate or star-shaped with several cytoplasmic extensions or processes. Here again, we note that the cytoplasm of these cells contain dark basophilic material, and in electromicrograph, this material will turn out to be abundant rough endoplasmic reticulum, which is associated with protein production. This is an even higher magnification of the nerve cell. showing again its huge size in relation to the ordinary connective tissue cells. Once again, the nucleolus of the nerve cell, which is in the center, rather small pink nucleus, is about equal in size to the nuclei of other cells.